microneedling is what we're doing right now. This is something that's great for almost all skin colors. Check with your doctor if you have an extreme case of keloiding history, and specifically to make sure that you're still a good candidate. Generally, people don't keloid on the face, so that's why any darker skin patient can still generally do it. But always make sure. What we do is that the patient gets a little numbing cream applied if they'd like to, and then we clean it off very, very well to make sure that there's nothing on the skin, no bacteria. And then we use a vitamin B5 hydrating gel, and that just lubricates the skin. And we put on this little tube of growth factors. And growth factors, I'm going to reapply it, you get to see it, okay? This is something that contains all the products needed to stimulate collagen. And collagen is almost like scaffolding to the roof. That's what gives the skin its structural support. And we stopped making that in our early 20s. So when we create an injury, that is going to naturally have his body start stimulating collagen to repair it. But these little needles that are going into the skin are going to create these channels, and they infuse those growth factors. And then we put on some antioxidants, so it's going to make his skin more uniform, smoother, better texture. And you really don't have as much downtime. I tell my patients, you know, if you wear makeup, don't wear it for 12 hours because we don't want it getting in there. But the next day, you can go out and you look pretty good. Really not a lot of downtime. What's nice is we can get really close to the eye, okay? And this isn't a laser, so not as much worry about changes in your pigmentation from the procedure because there's less inflammation. And it's usually a series. It can be done once a month, or even I have some people like to do it every 2 weeks, depending how aggressive you get. And usually you need 4 to 6 sessions, okay? Sometimes we combine this procedure, and instead of using those little tube of growth factors, we take people's blood and we spin it in a centrifuge and we separate it. And the plasma component, part of it, has the growth factors in it. So that we can drizzle on top, and then we could even inject it into the skin for more of a lift. And that, what people know it as the vampire facial, but it's called PRP. So same thing, same concept, but generally you need less sessions. We say that's three sessions, a month apart. And again, you'll notice the texture, tone, everything looks just better with the skin, more radiant. With the PRP treatment, contraindications are if people take a lot of anticoagulants like heparin, Coumadin, or if you're on chemotherapy, or if you have any blood clotting disorders. Okay, there's different type of devices. This is one that we find to be convenient. It's a little stamping device. So we're going to stamp his nose a little bit. This one I'm just being more aggressive, so I'm using a bigger handpiece for this area. Really important that you only want special products that have been tested for this procedure, because other products, some can cause foreign body reactions and cause granulomas, which are little bumps in the skin that are hard to go away. So we use all approved and tested products. And this is going to help him get more uniform skin tone.
I mean, because since I've been doing this, and even on the SkinCeuticals, the texture of my skin has been better. Awesome, like, I haven't broken out, like, God knows how long.
Okay, that's it.